Hey guys, I'm going to be doing a video for you today to sort of get you guys acquainted and oriented to report writing. Report writing is something that we're going to be expecting for each and every one of you guys to do after you have a patient contact while you are doing your clinical time. If you've never written a report before and this is all brand new to you, the actual report writing itself can be pretty tricky. So hopefully I'm going to give you guys some tips to get you guys sort of acclimated to some of the things that we expect you guys to do during your report writing, give you guys some tips, give you a format to make things hopefully a little bit easier for you as you sort of reach forward. Please keep in mind that this is a learned skill, just like anything else you're going to be doing in school. You have to put some time into writing these reports, practicing these reports, getting your formula just right so that every time you write one, it feels a little bit easier. You sort of are able to recall the information the way that you want it formatted a little easier each time you do this. So you guys are going to have to practice this as well. A few things. First and foremost, as a student, when you guys are writing these reports, you have to make sure that you refrain from adding any personal information about the patient into your reports. It's highly frowned upon. We want to make sure that you guys stay away from that. And what I mean by that, personal information, phone number, name, social security number, address, nothing, right? The FISDAP program that you guys are going to be using to document your information, your patient information, doesn't even allow you to put it in there. So make sure it doesn't accidentally slip into your narrative. A couple other things. When you're writing these reports, we want to make sure that you are writing them at a completely non-biased format. No information about how you feel, no made-up observations, completely non-biased. Your personal opinion does not matter in this situation. It needs to be left out, okay? You're gonna run into a situation where you're not really sure if you have good information that needs to be included in your report. Ask yourself two questions. Is it pertinent and or is it relevant? If you can answer yes, sorry about that. If you can answer one of those questions with a yes, then you probably have a leg to stand on if it needs to be included in your report. If you answer yes to both of those, then it absolutely should probably go into your report. We want you to make sure that you're leaving out things that don't really do anything for the story that you're trying to tell. For instance, would be if you had maybe you had a patient who tripped and fell over their dog. I'm not really interested in the make and model of that dog, if you know what I mean. Just tripping over a dog is completely fine. The type of dog that it is completely irrelevant. So we want to make sure that we sort of filter out all the things that aren't necessarily relevant or pertinent, keep in the things that are pertinent and relevant to your story. Remember, these stories can be brought up in litigation if you have to go to court months and months and months after the event happens. So we want to make sure that as you write these, you write them in a way that if you had to pick this thing up in 6, 8, 12 months, that you can be sort of brought back to when the call happened. Yes, I remember that call. I would be able to sort of bring up any of that information based on how well I wrote it. It's jarring my memory. So always keep that in mind as well when you are writing your reports. The format, we're going to be using the SOAP format. The SOAP format is sort of the gold standard right now for all pre-hospital report writing. This isn't something we're going to teach you guys. You have to learn SOAP, and then the minute you graduate, you go get a job somewhere else and they don't use SOAP. You're going to use SOAP, all right? SOAP, S-O-A-P. Please remember this outline as I give it to you, because it's exactly what we want you guys to do while you're formulating your reports. And I'm going to bring up a report for you guys to look at so that you have a really good understanding of what I mean, some of the verbiage that I'm going to use, abbreviations, so on and so forth. Last but not least, remember that the report is your own. Try not to copy somebody else's report. Don't emulate somebody else's report. It needs to be your own words. So maybe as you're learning, if you want to If you want to get a help aid from somebody you might be riding with, maybe the paramedic or the EMT that you're interning with, they're going to be nice enough to maybe sort of let you look at their narrative. Yeah, sure. Maybe you can pull bits and pieces of that report into yours so that you can sort of make it whole. But we want this to be your own story. All right. So remember that going through. So I'm going to go ahead and pause the video real quick, and I'm going to bring up a report for you guys, and hopefully we can get through this together and give you guys some sort of idea of what we want you to do for your narrative. So I'll be right back. Okay, and welcome back, guys. So I have up on the screen right now a example of a report that I wrote a little while ago, but it's a very good sort of example of a solid BLS report that sort of encompasses all of the pieces that we want you guys to have in your reports as you learn this ability. All right. SOAP, remember, that is our SOAP format. Now I'm going to go through all of these with you here before I go and read the report. I just want you guys to get comfortable with the components. Your S stands for subjective. Just as it's defined in the dictionary, subjective is information that's told to you by somebody who's not you. Speaking to yourself in third person does not count, so I don't want to see anything like that. Your primary source of subjective information 95% of the time is going to be your patient. It is okay if there is a family member or a caregiver or a police officer or maybe a bystander who witnessed the incident to be a good source of subjective information as well. Maybe your patient is altered, maybe your patient is unconscious and they're not able to tell you what happened. You may have to use somebody else to be that subjective source of information. So don't be afraid to use your resources around you. Again, here's where the pertinent and the relevant comes into play. If you're not really sure, just ask yourself those two questions. You can get on some scenes and there will be a lot of people who have a lot of things to say. It's going to be up to you to sort of filter out what needs to stay and everything else that needs to go. All right, so S is subjective. So I'm going to read through the S here so that you guys have a good idea of what I'm talking about. Remember, this is what I was told upon entering the scene. Patient relates onset of weakness while driving home. He pulled over at the nearest gas station and activated 911. Patient relates onset of blurred vision and became diaphoretic just prior to engine 1's arrival. Right? So that is him telling me what happened. And sometimes it's just as easy as me saying, "Hello, sir. What's going on today? What happened? What made you call 911?" And let the patient respond back in their own terms as to what they feel like the emergency is today. Also, guys, please remember, as I go forward here, you're going to see there's a lot of abbreviations. You are allowed to use abbreviations. Please keep in mind, though, they have to be approved abbreviations. You cannot make up your own. There are a couple pages in your book dedicated to approved abbreviations. I don't know what they are. You guys can just do a little bit of searching for your abbreviations, but they are in there. There are a lot of them in there. I have picked up abbreviations over all of the years while writing reports. And these are the ones that I'm very comfortable with using, and they are preferred for my style of writing. You don't have to write abbreviations. It's completely up to you, but I have found it makes your time writing these reports a whole lot shorter. So keep that in mind. Okay, so pick up right here for those of you following along. Patient is awake, alert, and appropriate, denies any loss of consciousness, chest pain, shortness of breath, head, neck, or back pain, abdominal pain, headache, nausea, vomiting, or trauma. Patient relates he has an extensive past medical history of diabetes, and he believes that his sugar is getting low. All right, so you're going to see that in that S, I have only listed information that the patient has told me. All right, nothing of that was of my own. Nothing of that was things that I felt like needed to be in there. I asked the questions, I got the answers, and I've documented it just in that same very way. When I have the patient awake, alert, and oriented, denies any loss of consciousness, so on, so on, and so on, and so on, I asked the patient during the time that I spent with him, "Sir, do you have any of these other symptoms?" Remember, just because the call comes in as weakness Doesn't necessarily mean that your patient doesn't have chest pain or shortness of breath or abdominal pain, et cetera, et cetera, et cetera. But I ask these questions anyway, therefore I sort of narrow down the possibilities of what might be happening with my patient so I can really define my treatment. Otherwise, I have a lot of examples, a lot of possibilities that I can pick from. I might spend a little bit too much time looking for things when I could be treating what's actually happening with my patient. So keep that in mind. If he's awake, alert, and oriented, and he tells me that he is a diabetic and he feels like his sugar is getting low, there's no reason in the world why I think that he's lying to me. I hope he wouldn't lie to me. He called me to help him. We are there to help. Listen to your patients. If he tells you he's got a past medical history of diabetes and he thinks his sugar is getting low, well, it's probably going to be a really, really good idea for you to check your patient's blood sugar, okay? But again, my sample starts with the subjective, my SOAP starts with my subjective. Everything in that subjective is information that is told to me by either the patient or somebody else on the scene.